what gets measured improves.
Yeah.
Yeah.
It's,
And that's what our patients do is they call in weekly weights. They can, and if they don't have a scale at home, they can just come to one of our offices anywhere in town. Our offices are all easily well located. Our obesity clinic is run by one of our nurse practitioners. She was really motivated, went out and got a catch grant. And so one of our pediatricians helps her, supervises it. And then, but it's really her baby. She gets all the credit for it. And she's worked with our school nurses too to do remote or to do weights if they don't have a scale at home, and then is working actually with the school district now to incorporate some of the exercise into the school district because we're having a hard time getting people to show up for exercise class.
Yeah. So it sounds to me, and I wouldn't be surprised that you probably do ADHD management and evaluations. You probably do anxiety, depression, all the behavioral health, mental health stuff. It sounds to me that this is a chronic care program that you establish, which chronic care flows right into this value-based stuff.
and then one more question. You said 6 psychologists.
Yeah,
How how can you afford that?
it pays for itself.
Wow.
They see patients, about 7 patients a day for hour-long sessions, and it pays for itself.
That's good.
And you through insurance coverage?
Mhm.
Wow, that's phenomenal. You can do that in Northern Virginia. First, you can find the 6 psychologists because in Northern Virginia, and just I level set all the time because every city is different in the US. Montgomery County is in Maryland, is just northwest of DC. Fairfax County is just south of DC. And where I live, Loudoun County is southwest of DC after Fairfax. Those are th three of the wealthiest counties in the country. And you cannot find a CBT therapist to save your life.
I
That
Yeah.
can almost guarantee you cannot find one that takes insurance.
not
They're all
even
on cash.
not
Yeah.
they're all cash. They start at
Oh,
800 at $180 a week, as high
yeah,
as $300 a week.
yeah,
And even if you have the $300, they have waiting list.
yeah,
And
Um,
that's probably our biggest barriers. We have a lot of patients who don't come in because they can't afford it. But we
yeah,
have enough patients who need it that will pay for it, and they're not, a lot of them are paying for it out of pocket because it goes to their deductible. So they have insurance, but it's not paying for it. And that's probably our biggest barrier. The other barrier is getting testing approved. A lot of times we
yeah.
have to spend a lot of time on testing. But yeah, so our model about 20 years ago, one of the moms of one of our families was getting her PhD in psychology. She needed to do her clinicals. And so she did it embedded in our clinic as a part of her training. And then we hired her. And then she started recruiting, and we've just gradually recruited people out of the university based setting, provided them with clinicals when they needed it, and taken advantage of that opportunity. And I would say the psychologists love it because they could go out and hang a shingle, but they like being embedded in the pediatric practice because they have direct interactions with the primary care docs. And they like managing patients with pediatricians better than with psychiatrists.
yeah,
Just throw
yeah,
meds at kids. We really appreciate their input, and I need their input. When Dr. Davies messages me in our EHR and says, this kid's anxiety is not going to be managed by CBT alone, this kid needs medication, my nurse can call and get that kid scheduled for later that week when I have an opening, and we get them on medicine right away. And so having that immediate feedback is great. But the cost is a huge barrier for families. And
I
some
have a
of
similar relationship with Dr. Karen Larson here in Northern
it.
Virginia, and she's phenomenal. She's a motivational psychologist.
Mhm.
Her practice has school psychologists that do the IQ, reading testing,
Mhm.
motivation, maturity, because every child is different, so they may be
Yeah.
struggling for a different reason.
Mhm.
And I love working with her. And she's not expensive. She's $180 an hour. It's the same kind of relationship. She'll call me and she'll say, I saw your patient Johnny. I don't think that a stimulant is good for this kid.
Mhm.
Why didn't you change
Right.
him for Cetera? That seems to work better for this kid with dual anxiety and ADD, ADHD. I've had a lot of luck.